Yeah, there are three things that we are monitoring for our loved one, our elders. First is the blood pressure. Second is body temperature. Third is heart echocardiogram. Next, please. Next, please. Yeah, next, please. And blood pressure, as we have heard many times, that our parents always complain their doctor scold them when they go to see doctor because their blood pressure shoot up when they are visiting clinics or hospital. But in fact, their blood pressure at home are pretty normal. It is some kind of a fear or scare when they go to clinics and hospital, and blood pressure shoot up, and there you go, they have more medication, more dosage, but in fact they don't need that additional dosage. So this is the problem that we have seen happen almost everyone around us, or with our own parents. So we have developed a blood pressure monitoring system where the patient or the elderly, they can, or anyone, healthy people, they can install the mobile apps on their phone, as simple as that, from Play Store or App Store. And with the proper system, if they have a prescribed medical service to a specific healthcare facility, they can even point their apps directly to their doctors who are in charge of looking after them. And doctors also have their own apps linked directly to the patient. For a healthcare service provider like hospital or clinics, they also can have an administrative overview of every single patient and doctors' quality of service through this system. And with that, this is an ecosystem that we have developed to triangulate patients, doctor, and healthcare service provider to ensure seamless connectivity and interactivity. Next. This is a very simple dashboard where everyone will know how to read this. And this is the doctor's screen where they can see this particular patient blood pressure readings in historical manners. This is what time, what dates it's taken, and what are the blood pressure. As we know now, blood pressure at home is always more accurate because it's more comfortable, relaxed, and that is a real blood pressure. Next. And this is the one photo taken of the blood pressure monitor on the left, and the mobile phone where running the mobile apps on the right. And this is how the data from BP readings can be synchronized to the mobile apps and synchronized directly to doctors, and also even you can synchronize it to caretaker such as family member. Thank you. Next, now we have move on to a second system that we collaborated with either on the path. Next, where we can see we have these sensory devices as small as next slide, please. Like it is as small as a plaster that can stick on our chest or under the arm, that can measure multiple vital signs such as heart rates, respiratory rates, electrocardiogram, triaccelerometer, and body temperature. And this data will be wirelessly synchronized and transmitted to the control center in the care facility. In this case, it's either on the path, and the data are real time. And whenever there is any abnormality, which means sometimes the heart rate is too high or too low, or respiratory rate is too low, the system will automatically send notification or triggers the proper follow-up actions by the facility service provider. So this is very simple diagram. As you can see, these pages, wireless pages, sync to mobile phone and go straight to the cloud service. Next, please. And the patient, anyone, they have a very simple to use mobile app, and this is one of the interface. As you can see, the temperature, Next, please. And this is a heart rate, respiratory rates all together, and even the user, the patient themselves, or the residents themselves, they can see a historical plots of their own heart rates, respiratory rate, and temperature. Next. And this system is to monitor the cardiac condition of the users. Next, please. Where the control center in the elderly care facilities such as on the park, they will have a dashboard like this, where the nurses or even doctors or administrator, they can use any computer to look at this dashboard and see all the residents' real-time heart condition as this graph showing you. They can even zoom in and zoom out and span across a month or day or week or even hours. Next, please. Which we would like to report that we value that a lot of advantages using this AI, which is artificial intelligence powered monitoring system in senior living facility. Cardiology surgery history sometimes can be very tricky, but if we have a remote sensor like the one I show you just now to look at the echocardiogram, it removes a lot of stress on the caretaker, either the family member or anyone they love. And chronic disease especially can always be monitored without any gaps in between. It is not like when you go to see doctor, only doctor measure you, but these devices give real-time updates all the time, and the health condition can be monitored almost at all time. And one important thing that we also learn together with either on the part is that a lot of stress, a lot of pressure has been removed from the caretaker or caregiver. They don't have to walk near to the resident to look at their temperature, to touch them, to look at their heart rates. That is very disturbing. If they can see this data all the way in the control room without even visiting the resident, that gives the residents a lot of peace of mind and, of course, highest quality of sleep. And we can see the quality of life of our residents in this healthcare facility is very significantly improved.